Good afternoon, everyone.
Good afternoon.
Sorry, it's just on the final loading bit. I'll say when, and then my screen will go black. Apologies for this, everyone.
No, that's fine.
All right.
Hello? Hello, can anyone hear me?
Yes.
Can anyone hear me?
Yes, we can. We are. It says we are live on YouTube. I think it's gone live already.
Okay, yes, right. I'm going to go blank. Ready when you lot are.
Super. Okay, good afternoon, everybody. We're really happy to be here today here in Northampton, and we are hosting wonderful women from Northamptonshire in celebration of the Black History Month, but most important, Democracy Week. And we would like to give a huge thanks to Northampton Borough Council for putting this together. And at this point, I would like to invite my co-host, Marianne. So there'll be two of us, Marianne and myself. So my name is Anstance Fometu. I live here in Northamptonshire and particularly Northampton. And all my children are here in Northampton, and I'm an independent social worker. And so Marianne, would you like to introduce yourself as the co-chair of this meeting? And then we'll go to our speakers and acknowledge all the people that we need to acknowledge for this event. Marianne?
Good afternoon, all. As you've heard, my name is Marianne. I'm so excited this afternoon to see all of you. I'm sure we're going to have 1.5 hours of excitement. It doesn't take much to excite women. We just need to come together. We just need to have a chat, and we are happy. It doesn't take much. So we are so easy to please. And we aim to please you with information, with all the guests we've got, on all the speakers we've got this afternoon. Feel free to share anything you've got. Send a message in the chat, and we're going to be looking to answer some of your questions this afternoon. If not, we're going to make sure that you can get your answers at the end of the session. So my name is Marianne. As you've heard, I live here in Northampton. I am the BAME officer for Northampton North CLP, and also a local candidate for the next councillor election. If I can get my words out, I need to put my teeth back in. So I'm happy to be here, and I'm hoping we're going to have a really good afternoon sharing different things, looking at the impact of COVID, especially on the BAME community, and what is it that we can do as we move forward. We've had one of our guests this afternoon, not guests, one of the participants have to leave to go and pick up her child because they were called in. So those are some of the issues that we face with women, and especially with COVID and the new wave that is coming along. So I'm looking forward to that. Understand?
Yes, so there's so much to talk about, but we have tried really hard, thanks to Danielle and the team that's been working tirelessly in the background to help us narrow down this conversation. I think it's important to acknowledge that the BAME community has suffered quite a lot, but it's not just the BAME community. Everyone has been affected by COVID all around the world, especially here in England. We have seen a high proportionate numbers of Black ethnic minority suffering and losing their lives in line of duty. So for that, we thank you for all the people that are sacrificing, their lives. They are working in the front line, in the NHS. They're working in, deliveries, schools. That's been really appreciated for all the work that they are putting in. But we also know that many of our colleagues, BAME communities, are working in the front line in the NHS. That's been acknowledged. And they've also suffered in terms of loss of life, but also in terms of just the consequences of being in close contact with the public, and COVID has affected many lives. So on that note, really, it's just my pleasure to introduce a fantastic panel. We have divided our conversation into education, health, as well as the social impact of COVID, particularly on domestic violence. And we have a fantastic panel of speakers who are experienced in all these fields. They're all frontline workers, and they are an amazing group of ladies, and I think we've got so much to learn from them. Marianne?
Yes, our first speaker this afternoon will be a friend to, actually I found out that we work for the same organization, which I did not know. So it's a very small world. So we have a doctor who's going to be bringing a different perspective from medical world in terms of the impact of COVID on the BAME community, and looking forward to solutions. What is it that we can do? That's the aim of this conversation this afternoon. What is it that we can do? We are looking for some actions that we can take forward. So without much ado, I'm going to invite Dr. Emma to take the floor, and you've got 15 minutes, and I'm sure it's enough for you to tell us a lot on what you do, introduce yourself, and what you are hoping to share with us this afternoon. Thank you.
All right. Well, thank you very much, Marianne and Anstance. So yes, like Marianne said, my name is Emma. I'm one of the, well, I'm a doctor. I've been working in physical and mental health in the UK for the last 10 years. A member of the Royal College of Psychiatry. So yes, and I'm currently working at St. Andrews, which is a little private hospital in the middle of Northampton somewhere. Okay. So it is a privilege to be invited to this talk. I'm generally very, very shy. I don't like speaking, but I came over all of that to come and speak to you today. I'm quite glad that the remit of this discussion has been limited to 3 very important questions. The questions are, why were we, the BAME community, the women, the families, households disproportionately affected by the coronavirus pandemic? How did we respond, and what do we need to do now? I won't be able to answer all of these questions. And I think even though they are just 3 questions, there are 3 very complex questions with no easy answers and no easy solutions. It's not disputed at all that people of Black and ethnic minorities communities were disproportionately affected. In the first wave of the pandemic, we had Public Health England, which was like the governing body, and from their publication in May, just towards the end of that first wave, it became clear that people from South Asian origin were 2 times as likely to die from this pandemic as white people. Black males were 4 times more likely than whites, and people of other BAME ethnicities. So other Indian communities, Black Caribbeans, Chinese, and so on and so forth, were 10 to 50 times more likely to die as the whites. And why is this? It's not clearly understood. It's not a clear-cut picture. It's not black and white. There are many, many kind of factors which are contributing to this. Some of those factors are biological, so they are inherent within us, but a lot of them are environmental. So one of the things that became clear is that, people from socially and economically deprived backgrounds were at higher risk of COVID deaths. a lot of our BAME background are socially deprived and economically deprived. And so we kind of fell into that group. There was also a proposition that people from the BAME community are more likely to have had a poor previous hospital experience, and therefore are likely to kind of avoid going to hospital as much as possible and leave it to the very last minute, which means by the time they get to hospital, they are very unwell. And a lot of people, there was a disproportionate proportion of people from the BAME community ended up in critical care compared to the white communities. Another factor that kind of stopped people from wanting to seek medical help when they first got unwell or even considering was language barriers. So for people whose English language was not their first, their mother tongue, they perhaps struggled or were resistant to the idea of getting any help till it was a bit too late. We do know that a lot of the comorbidities that kind of make the risk of dying from COVID higher are more prevalent in the BAME community. So things like obesity, diabetes. It's in some communities it's a genetic, I guess, preponderance. So especially among the South Asian people. So a lot of the Bangladeshi, Pakistanis do have a high proportion of diabetes, but some of it is just the socioeconomic deprivation. So things like obesity are basically very often down to poor diet, lack of access to exercising opportunities, and so again we see that complex interplay between environment and biology over there. Another thing that was quite evident was that what you do for a job does affect how much exposure you will get to COVID. So people who work in healthcare and who are frontline workers, for lack of a better word, are far more likely to be exposed to people with COVID. People who work in healthcare do not have the luxury of working from home. There's nowhere as a nurse or a doctor or a healthcare assistant you're going to work from home because your patients cannot have you working from home. So yes, we were very exposed to COVID. As at the 14th of May, there had been 10,841 cases of COVID diagnosed in nurses, midwives, and nursing associates. This was during the first wave, and over almost 80% of those cases were in BAME communities. In London, for example, where we know that's where we had the highest number of cases. Recent kind of statistics that was done shows that the healthcare workers, the health force over there, over 67% are from the Black and ethnic minority communities, and therefore, just as a consequence of where we find ourselves working, we were excessively exposed. And again, where you live, that's kind of counts. So you live in highly populated, urban areas. You are more likely to have to live in a place where there's a high risk of COVID. We know that a lot of the most intense area of infection was in London, and over 40% of the population in London is a minority. So there are a lot of reasons, socially, economically, and biologically, where we're exposed. When the COVID pandemic first started, there was a lot of excitement about the role of vitamin D in protecting people from becoming very unwell with COVID. They were not able to associate a direct link. However, we do know I mean, COVID aside, that vitamin D, apart from its role in supporting your bone metabolism, has a very strong role in immunity and in keeping your body's immunity strong. The recent advice from the NICE guidelines is that everybody should have vitamin D supplementation. I mean, independent of whether you're black or white, we should all have about 400 units a day of vitamin D supplementation. However, we do know that for those of us with darker colored skin, our bodies are not optimally forget which word to use, but we're not as good at converting vitamin D from the sunlight as people with lighter skins, just because of our genetics, and therefore very often what we do find is that people from BAME communities are vitamin D deficient. Unfortunately, vitamin D deficiency does not really you don't have any very specific symptoms for it, except feeling a bit tired and a bit under the weather sometimes and having a bit of aches and pains over here. So it's something that's very subtle, but very important. And I do kind of encourage all my friends and family to have their vitamin D levels checked. If you're deficient, get it replaced. Even if you're not deficient, and it's very, very unlikely if you're a Black person living in England that you'll not be deficient. Even if you're not deficient, a daily supplement of 400 units, easily bought over the counter anywhere, will not do you any harm and probably do you a lot of good. Okay. There's also a lot of excitement about vitamin C. And again, no direct link, but again, vitamin C is one of those things that is really linked to immune health. I don't take a vitamin C supplement because I take an orange instead, but fresh fruits contains lots of vitamin C, so oranges and all those citrus fruits, and just looking at what you're eating and making sure that you're eating balanced diets and having lots of fruits and vegetables, I think that helps. Okay, so the question, I've skipped one of the questions because I know how I responded, but I'm not sure how everybody else responded. And I know how my friends and family responded. And I don't really, as much as, how we responded then matters, I don't really think it's as important as how we respond now, going forward, looking at the second wave of COVID coming in. I think one of the most important things is that we follow the government social distancing, keeping 2 meters away, wearing a face mask if you're going into somewhere where you cannot keep 2 meters away, hand washing and all that. I think those are all important. Having said that, I'm really hoping that we don't go into another social lockdown, because WHO publication came out the last 2 weeks and just highlighted how childhood poverty, malnutrition, general poverty has kind of more than doubled during these lockdown periods. So it's almost a catch-22 situation. You go into a social lockdown to prevent the spread and cut down the deaths, but then you have far worse off socially and economically, which then kind of almost leads back into the behaviors that we're having that kind of spreads the disease. And so it's a bit of a difficult situation, but we just need to go. We need to see how we deal with day by day. The other thing that you want to look at is keeping yourself mentally and physically well, because if you are mentally and physically well, your immune system is boosted and you are less likely to have severe COVID infections. So looking at what you're eating, keeping yourself active physically, exercising. If you're feeling, stressed out, depressed, anxious, speak to somebody, reach out. There's always someone who you can speak to. If you can't find someone who you feel you can speak to, call Anstance. She's always a good listener. And if Anstance can help you specifically, she can always find someone else who can help you. I found out about Anstance. So yeah. So there's that. And like I said before, I personally I think a vitamin D. I think that if you're on this call and you're a BAME lady, speak to your GP about getting a vitamin D test, because very often we are deficient. But even if you don't want to do that, just getting a vitamin D supplement. This is the new government guidelines on vitamin D for everybody to have a supplement. You can buy it over the counter, 400 units a day. Okay, all right. I think that is as much time as I'm allowed. I'll try not to talk everybody off. If you've got any questions afterwards, you can. I'm happy to answer any questions at the end of the talk. Thank you very much.
Thank you so much, Emma. It's really important to emphasize the fact that yes, we need to follow guidelines, wash your hands, social distancing, wearing your mask, and also the importance of mental health cannot be underestimated where there's a lot of isolation, and yes, we have suffered, and we are seeing some of the consequences of being isolated in terms of cabin pressure with those of us with children. We have complex behavior issues. I'm sure the schools are picking up some of those the consequences of severe lockdown. And on that note, Marianne, what would you like to add in terms of what Emma has just shared?
I think one of the key things is the childhood poverty, especially, and the lockdown and the impact of lockdown on the economical situation for most families, especially where people do not have the privilege of working from home, because I count it a privilege if you're able to still continue working from home. For those who have jobs, especially manual jobs, or where they work in sectors where they cannot work from home, then those families have really suffered economically. And we have also known how difficult it was for families to claim their universal credit. So that in itself has impacted how children and families were feeding, which on the other hand, so people are coming out of lockdown, very not healthy, and on the other hand, being exposed to COVID. So it's a really catch-22. So we need people we want the economic to be strong, but we want people to be healthy, but we don't also want to be in lockdown. So I don't know which one is. I think that's what we are going to be trying to find out this afternoon. So if anyone has an idea we can take forward, this is the time for us to share and see what it is that we can do. For me personally, especially having the schools open, and especially for those who are working from home, you're a working mother and you have children who need to be homeschooled. You still have to get the balance right. So the impact on children's education, I'm glad we have someone from education here today. Because it's how do we still make sure we provide for our children, we provide for our families, at the same time we do our self-care, because the importance of mental health in keeping ourselves sane and keeping ourselves strong to be able to take care of everybody else. As we know, as women, we tend to take care of everyone else and forget ourselves. So it's really important that we self-care during this time so that we are able to take care of our families, immediate families, and people who have the elderly relatives, for example. You still have to take care of them. So it's a huge burden on women especially, but we have to take care of each other. So yeah, that's my thought on it.
Yeah, and I think one of the factors that we've seen the impact on young adults who've returned back to university, and if you're already deprived economically, one of the consequences of lockdown and lack of economic activity is that students are not able to have those part-time jobs to sustain them at university and give them extra income. So again, if you're coming from a already economically deprived background, that extra work to work in the bars, to work in the restaurant has been taken away. So again, it's the poor that are being affected a lot more than those of us who can supplement our children who are at university. So I think it's really important to also think that the young adults who are back at universities from underprivileged backgrounds are going to be affected even more, and their families, the pressure will be even more. And when you're affected by the pocket, the tendency is to buy cheap food, and that means high on carbs because potatoes are cheap. Steak is not cheap. So fruit is very expensive too. So fresh fruits and all the things that are required to keep us going are really against a lot of young people coming from already deprived backgrounds. So there's a lot that COVID is affecting in our community, and some of it is our young adults who are at university. On that note, I would like to invite our next speaker, who is Esther Mcintosh, and she's an education. I call her the education lady. She sorts out all the education issues. She's a fantastic lady. I know her personally as well. I'll let her introduce herself, but it's a pleasure to introduce Esther Mcintosh to everybody. Esther, it's your turn to tell us what you have for us.
Well, good afternoon, everyone. Yeah, my name is Esther. Nice to see you on screen, Anstance, and a few other faces that I can put a face to a name to. So really great to be part of this amazing team of women. Yeah, I have been in education for a number of years. I'd like to say it's not just a job I do, it's a passion of mine. I bleed education in the sense that it concerns me that children fulfill their potential, and wherever I see a child, a young person, an adult, if I can impact their lives by challenging them to be better and do more, I'm going to do that. So the angle that I come from, I'd like to say it's very grassroots. I'm in there. I'm in the trenches with my children when I was in the classroom, and their parents at the beginning of the day, end of the day, and you know, wherever there's a need, I'm going to be there. So my work is very much grassroots, community level, working with the parents and the communities that they're from. So that would include churches, places of worship, wherever those needs are as they relate to education, I'm there. Or I like to be there. I can't be everywhere at the same time, but I like to be there. So the other thing I want to say about myself is, about the approach that I take to life, I think you're either part of the problem or the solution, and you choose. I like to identify what the problems are, but I'm more interested in solutions and how we can, you know, make impact and change things for the better. So in answer to the first question, why were the BAME women, communities, families, households disproportionately affected by the coronavirus? The way I see that is that the virus by its very nature, or viruses by their very nature, they don't discriminate who they attack, what they affect. And we've seen this in the months since March of this year. Certain groups, the BAME group, has been affected significantly. But I think before we address COVID, we have to see what the pre-existing issues were, especially in relation to education. And we know as a community that exclusion rates amongst Black boys in particular, we know that the grades of children within the classroom, the issues that relate to Black and mixed children are long-standing issues. And so because those issues were there before COVID, COVID has just come and exacerbated everything. So it's showing up more than ever. So those, you know, I asked myself the question, what's happened to those children who have been permanently excluded amongst Black and ethnic minority communities? You know, where are they? We to a great extent, we've lost sight of them. They're out there. They're I was going to say underclass, but they're out there. And whether or not they're part of the statistics, one doesn't know, but they're there. They've been excluded. Funding cuts has affected our community. Here in Northampton, you know, we had head teachers not so long ago speaking out against the cuts and how they have impacted the delivery of education, budget cuts. You have to make decisions about priorities, and sometimes certain groups they fall off the need for real input, and that's usually where the greatest needs need to be. Housing, our people, our communities, we have to look at the housing issues, unemployment issues around that affect our communities. So these prevailing circumstances will most definitely have increased. So what I'm saying is that they were there before, and because they were there before, they would not have dissipated, they would not have vanished into thin air. What COVID has done has brought it to the fore, and to some extent, to a great extent, that's a good thing. It's sad, the fallout in terms of death and sicknesses, and you know, it's so sad to be speaking of those issues, but the fact that it's been brought to the forefront means that we now have an opportunity to do something about what has been a prevailing issue for decades now, as it relates to education. How did the community respond? It's difficult to say in any single way how people within the BAME community responded. I always raise an eyebrow when questions are asked of communities in a singular sense, only because we're not a homogenous group. We have within our BAME community, we have a variety of approaches, expressions, worldviews. And so to say how we responded in any singular sense is really unfair. We wouldn't ask that of any other community. You know, if we wouldn't say, well, how did the white community respond? Because there's no single response. However, I do respect and understand the question. What we can say though is that with the lockdown, for so many children within our community, it would have meant, not for all, because each family has their own value system and their own economic situation. But for a lot of children within our community, it would have meant a cessation of education. In other words, lockdown meant no education, no learning. I don't know if that's actually possible, because I believe as long as you have eyes to see and senses, you can learn. But in the formal sense, it would have meant education stopped the moment lockdown stopped, which meant they would have been denied of the rights of their education. because it was right to, you know, we follow the government's lead and that was right to do. But lockdown would have meant that many children within the BAME communities would have fallen drastically behind. And that is worrying. That is, again, it's been brought to the forefront. Let's address it because it's here now. It's in our faces. The children of Black and ethnic minority within that group have fallen significantly. They were behind in terms of the stats, but now it's kind of accentuated. And I can only talk about what I have done in that time, and I'd like to share that with you. As I said, I'm an educator. I've been teacher for a number of years, head teacher of a school. Also, I came out of formal education and started a group wherewith on a Saturday morning I would educate children from, I think, 4 to 18. And we would focus on the core subjects, English, maths, and developing public speaking, developing their confidence, giving them a rounded view of history. We're still in Black History Month, aren't we? And you know, for us, we felt that Black history is everyone's history. It's not just for Black people. You cannot isolate history. You know, history doesn't happen in a vacuum. There's Black history, there's white history, there's Asian history. Black history is everyone's history. So when you're talking about the Tudors, let's look at what was happening in Africa. Let's look at what's happening in the other parts of the world, because it's not an isolationist world that we live in. And so we felt that it was important to give children a rounded understanding of history. So that was some of the things that we did. As of the middle of, as of March, everything stopped. And I will say for a short while, I stopped also and took a breath and said, what am I going to do now? And by the middle of June, with the technology, and that's one thing I want to raise today, with the technology that we're all using here, Zoom and Google and what Google provides, I have been able to continue learning with the people of my community or any community who want their child to continue learning. And what I've seen is that with the technology, there is no excuse really for a child not to go on learning.
Yeah.
I'll let that sink in, because it had to sink in for me, because I thought the only way to do learning was face to face, you know, see them, touch them, you know, over their shoulder, how you getting on with that calculation. But I saw that, as I'm seeing now, we can continue to relate and to have interaction and continue to address issues and make changes. And that's what has happened for me. So I took a breath, I took a step back, and I said, wait a minute, as long as my parents are willing to go on this journey with me, I can still provide quality education in the way that I was doing before. In fact, I can meet many more, I can educate many more children through this technology, because since then I've been also to bring in on board undergraduate students and graduates as well, some class teachers, you know, taking on 2 or 3 students to coach them in their maths, A-level physics. I've just had a parent say, I need an A-level chemistry tutor. What have you got there? So now I find my role changing. I'm looking for tutors, bring them in. So when I talk about solving problems and not just being part of the problem, but being part of the solution, this is what I've been enabled to do through lockdown. Now, it still concerns me that I'm not meeting a fraction of the parents out there because of reasons to do with getting the word out, which is something I'm doing. And what I've also learned in that time, I must hurry on, that the way that our communities have been impacted is, you know, they need the technology, they need a laptop, they need one that works. That's not their fault if it's broken. But if it's a question of buying the fruits, instance, that you need to buy, and you know, there's not much left to buy or to repair that laptop, then there are issues, and that affects learning. What I have said to my parents, whatever technology you've got a small, if you smartphone, we will use whatever you've got, because my passion is for that child to continue learning. So in bringing to an end what I want to say, I must get everything out. We've come into the close of the Industrial Revolution. That change, that was that was a game changer for the world. I think we are very much at the start of and in a technological revolution. And I think the way forward for education, especially hearing that right now parents are having to bring their children out of school. We don't know when it will shut down again, what level, with what extent. We must be ready with the technology. And those schools that have done well during the lockdown are the schools who were financially able to invest in the technology to continue educating their children. Those schools in the poorer catchment areas where budgets were cut, the resources, you know, laptops, tablets not working, broken. I've been in school, I've tried to teach and deliver IT, it's not working. It's not the fault of the school, it has something to do with policymakers, local and national, really investing in the technology. So regardless of whether we are locked down or not locked down, learning can continue. So in terms of what we do, policymakers must recognize that there are barriers that have been there for decades. We've got the stats, we know what's out there, and we must be willing to really tackle those issues face on. They're right at our nose, let's deal with them. I think I've said pretty much everything I wanted to say. Thank you.
Thank you. Thank you so much. Marianne, what are your thoughts on what Esther has just shared?
Oh my goodness, Esther, you've got so much going on that there's so much to break down. But one of the key things you have said, these issues were there before COVID. What has happened is just because now we can see them more, people are talking about them more, but they were always there before. So, and I think it shows there has always been a gap in terms of the facilities and the resources that are being made available to our children. And I think that is something we need to be prepared, just in case there's another lockdown. As parents, as women, as people of BAME community, we need to be more proactive in making sure that the standard of our children in terms of their education carries on, because they're already disadvantaged just by the mere fact they're Black children especially. So we really need to up our game. And I talk that for myself, and to make sure that I'm on top of what needs doing, and also pushing for the resources to be provided for our children. It's really key that we get that going. In relation to the Black History Month, I like that you mentioned that, because we're still in October still. What was interesting was what happened to me yesterday. A lady I work with, a 50-something-year-old woman, came and asked me, what is Black History Month all about? So it's really good to hear that you are teaching young people about what Black History Month is about, because believe you me, there are so many people so ignorant, thinking Black History Month is about Black people, about forgetting it's about, it's a British month. It's for everybody. Thank you so much for sharing that. Anastasia.
Yes, I think I totally agree that there's a lot of prioritizing that needs to happen. And at the moment, technology is a priority for families. And thank goodness, and I say this is, at least we don't have to do lots of clothes shopping. We are all working from home, those who are working from home. So save up your monies for laptops and for, you know, good phones for our children to be learning, to continue learning. The other thing that I know Esther hasn't mentioned this is that in my school where my kids go to, there's a saying on one of the windows that says laps can never be replaced by apps. That means physical reading books can never be replaced by apps or technology. We still have access to books. Get the children reading. And I know it's difficult for parents to sit down, but we have to sit down and continue doing those things that the school cannot do for all of us. So yes, it's good to have technology, but we need to remember that they are just apps. We still have to put them on our laps and read to our children. Education still continues. And like Esther said, everything we are doing, cooking is about education. We continue talking to our children, telling them stories, oral stories. If we can't read and write, there are people who may not, English is their second language, or they are learning as well. Read, talk to the children, you know, educate them in social skills, but they'll only do that by our interactions with them. So that was really a fantastic thing. The reality of it, like you said, is that this is not something new for BAME communities. We know the government priorities in terms of disadvantaged communities. We have experienced it. There is also racism that goes on within the schools. So an excluded Black child is just a statistic and forgotten. But now we are saying we will not forget those children, because now, as long as we are isolated, it's easy for us to be lost in the system. So thank you so much for that. And being significantly behind is a concern for all of us as parents and every community. And this extends to white working class boys who are also disproportionately excluded, coming back to the issue of economic disadvantages. So we need to understand that this is going to affect a generation if we are not careful and if we don't act as parents, as a community. And I know that this is across board, it's not just Black children, working class boys. So this is about the economics of the government and how they are going to distribute wealth in this very tight situation that we are in. We have to keep raising a voice for our children in schools and education. Education has got to be a priority and not lost in all these other things that are being discussed. So yeah, so thanks very much, Esther. Marianne? I can't hear you.
I'm on mute. Sorry, I'm on.
Good.
Oh,
you go ahead.
Okay. I'm excited about the next speaker because this is a subject to most of you who know me, which is a very personal subject. It's something I'm not proud of, but I am a champion and I speak for survivors of domestic violence as a survivor myself. So it's something close to my heart. So I'm really excited. We have someone from the Black Sisters, and I'm not sure whether we pronounce it as Janaya.
Janaya, yes. Hello.
Oh, fine. Yeah, thank you so much for joining us this afternoon.
Thank you for having me.
Excited and looking forward to hearing from you. Welcome.
Thank you, Marion, and thank you everyone. And it's great to be joined by such a wonderful group of people and to follow Esther's wonderful presentation, as well as Dr. Colansani. And I think a lot of what I'm saying will be building on what's already been said in terms of the fact that there was a crisis before the COVID-19 crisis, and the fact that the government policies and action and inaction has almost brought to the fore what's already been going on in our society. So my name's Janaea Walker and I work at an organisation called Southall Black Sisters. We're based in West London in Southall, but we have a kind of national reach in terms of the women that we support. We were set up in 1979 and we support primarily women and children who are survivors of gender-based violence. But lots of these women will also have interrelated problems in terms of mental health, facing destitution, homelessness, insecure immigration status. So essentially the support we provide is an advocacy service in terms of supporting a woman whether she needs access to housing advice, mental health services, issues in terms of regularising her immigration status. It tends to be kind of providing that holistic wraparound support, while also usually prior to COVID within the centre itself, building a bit of a peer support network for women, particularly those who are isolated, who have English as a second language, who may not have family and friends in the UK. So things such as weekly English classes, support groups, residential trips, so that women find their community and their home between one another. And in terms of our cases, I think the estimate is we have around 500 cases and around 6,500 calls to our helpline every year. We also do policy and campaigning work, which is drawn from our casework, and that's where my role comes in as the legal policy and campaigns officer, and that's trying to, I guess, take some of the challenges and the barriers that women are facing in their daily lives and taking that to government and to local authorities and to, I guess, the decision makers to advocate for women, particularly for Black and minoritized women. So to go to the question as to why were or are Black and minoritized women, communities and households disproportionately affected by the virus, I think the other speakers have outlined very well that we know some of the reasons that Black minoritized groups were sort of excessively exposed to the virus itself, as was described. And I think there's been lots of research, piling up in terms of Public Health England, but also Women's Budget Group, an organisation called Autonomy, said it's especially low-paid Black and minority women and migrant women who are currently putting their lives on the line to deliver vital care. So what I'm going to speak about on behalf of SBS is the question of the increased risk for Black and minoritized women in terms of their vulnerability to gender-based violence. And I think, as Esther pointed out, there was a crisis before this crisis. These were pre-existing issues, and these are long-standing issues that women have faced. Southall Black Sisters has long drawn attention to the fact that Black and minority women are vulnerable to high rates of gender-based violence, including domestic homicides and suicides. We know that currently there is a discriminatory sort of two-tier system of support in this country in terms of your pathway to protection as a survivor of violence. And I'll talk about some of the reasons behind that in this discussion. One of the principal things that we've been drawing attention to is the impact of something called the No Recourse to Public Funds condition, or NRPF. And what that is a condition that's applied to migrants in the UK without indefinite leave to remain. It can be applied to a diverse group of people, so sponsored sort of skilled workers, entrepreneurs. You can be a family member of a British citizen in the UK. You can be a self-employed person. You can also be an asylum seeker, an undocumented migrant. The No Recourse to Public Funds condition means that you are excluded from the safety net, as it were, that exists in the UK for the rest of the population. So universal credit, social housing, tax credits, and all of these forms of assistance are not available to you. Now, what that means in terms of women who are fleeing violence is that the alternative accommodation that you might require at your point of crisis, such as a refuge, is often not available to you. We'll call the mainstream domestic violence helpline or your local refuge service, and the question will be, what is your immigration status? Do you have no recourse to public funds? And if you do, that means that you don't have universal credit, which would cover the cost of your stay in that refuge. We also know that no recourse to public funds disproportionately affects Black and minoritized people. So looking, for example, at women or people on the 10-year route to settlement as a partner, child or parent of a British citizen, research by the Unity Centre found that 92% of this group were Commonwealth citizens, were non-white, and we find that particularly Black, African, Caribbean single mothers are very disproportionately affected by this condition. So this has been a long-standing issue for specialist domestic violence services in terms of really shouting about the fact that the usual pathway of protection should be available to all women, irrespective of your immigration status, and that the fact that, you know, women's aid statistics found that in 1 year, 4 in 5 Black and minoritized women were turned away from refuges because of that no recourse to public funds condition is unacceptable. We were already, prior to the crisis, facing a shortfall in refuge places of up to 30%, according to the Council of Europe. And at one point in a given year, there was just one place per sort of region for a woman with no recourse to public funds. So this was the crisis before the crisis. Not only looking at the no recourse to public funds condition, but there is also the expansion of border controls within our society. So when I say that, I mean embedded in statutory services, immigration officials, data sharing agreements between the police and the Home Office, so that if a survivor goes to the police to report a crime against them, they're questioned on their immigration status and are at risk of detention, separation with their children, deportation. We see charging policies within the NHS and questioning about whether someone has access to a passport before the provision of care. All of these factors mean that, you know, the usual life-saving points of contact for survivors within the UK are effectively out of bounds for many Black and minoritized women and for survivors. And then if you couple that with the long-standing issues in terms of, you know, lack of access to an interpreter, lack of skills or expertise in dealing with the issues that Black and minoritized women face, this is the discriminatory two-tier system that we're talking about. So when it comes to violence against women and girls in the COVID-19 crisis, what we saw is a combination of the stay-at-home guidance, sort of increasing the risk of violence at home for women, combined with a real absence entirely of any crisis response from the government to plan for, predict, and respond to the fact that we were likely to see a surge in violence. And then a refusal from government to lift the no recourse to public funds condition, to end or suspend these data sharing agreements. So you can see how we've really created the situation of entrapment for women who were already marginalised and excluded from the usual pathways of support. So looking back, which now feels like a long time ago, to sort of February, March, we were already seeing evidence coming from the likes of China and Italy in terms of a surge in violence against women and girls. And the sector as a whole was really concerned about, you know, if lockdown is glooming, what might this mean for women in these circumstances? Our helpline started to receive calls from women saying, I'm really concerned about the potential of being trapped at home. Not only of physical violence, but also for women who are subject to, you know, the severe coercive control over, you can imagine the kind of suffocating experience of being trapped at home, where the exceptions that you might have in terms of dropping the child to school or going to see a friend where you can have a temporary bit of respite were no longer available to them. And to give a flavour of the extent of inaction from government, it was not until 2 weeks after lockdown was implemented that there was even an announcement that there would be some extra funding for the violence against women and girls sector, given the surge in demand. It wasn't until 19 days after lockdown that the Home Secretary, Priti Patel, sort of initiated a public campaign called You Are Not Alone to encourage survivors to seek help. It came to the point where Southall Black Sisters, along with an organisation called the Public Interest Law Centre, had to initiate legal proceedings against the government to push them into funding alternative accommodation for survivors of abuse. We also started reaching out to hotels and to hostels to say, given that you don't have residents at the moment, would you open your doors to women and children in these situations? At the same time, what we saw, and which is really welcome, was a growing consensus from different organisations and from the public about the cruelty of no recourse to public funds. And we saw some faces like, you know, the local government association, the Work and Pension Select Committee, children's charities, really urging the government to lift no recourse to public funds for survivors. But that didn't happen, and it still has not happened. And so the consequence of that is that there was a real confusion on the ground in terms of people providing emergency support as to what the protection might look like for someone with insecure immigration status, with each local authority kind of taking a different approach as to what they would and wouldn't provide for women with no recourse to public funds. We had cases In Manchester, of a woman with no recourse to public funds who is forced to sleep rough because she was turned away from the homeless initiative on the basis of her immigration status. We had a woman who was told by the police that she should stay in her house with the perpetrator, but to remain vigilant. And we had women being housed in really unsuitable accommodation as part of the wider homeless initiative. You know, women who were very vulnerable, living in mixed hostels with other homeless persons with substance abuse issues, where they felt unsafe and there was a real risk of re-victimization. And what we now know is, unfortunately, what we anticipated is that there was a surge in domestic homicides, particularly in the first 2 weeks after lockdown. And some early analysis suggests that it is Black and minoritized women who are disproportionately represented in those numbers. And looking forward, I think, as there's so much discussion and confusion as to now in terms of local lockdowns, in terms of what the guidance means, in terms of schools closures, that I think the aftermath of this will be felt for some time to come, not only in terms of increased prevalence of abuse, but also the effect of, you know, increased isolation, women who are already facing mental health crises, women who were, you know, stuck in the asylum system for months on end, unsure about what their future held, being excluded from the really frontline services in terms of creating a community for them so that they had some peer support. And I think, just into looking at my time, I'll just go very briefly through how BAME communities responded. And I think, as has already been said, it's not a homogenous group, and it's very difficult to speak as if we are one voice. But as I mentioned, in terms of Southall Black Sisters work, we led the campaign for emergency hotel and hostel accommodation. Government refused to fund accommodation for the hostels and hotels that came forward to us, but we were able to secure emergency accommodation in London with the support of the Mayor's Office for Policing Crime, and set up accommodation for 70 women and children, which is running until the end of November. So that's been sort of a tangible thing that came out of our campaigning, and we're still trying to apply the pressure to make sure that similar schemes can be set up across the UK. And I think we were really invigorated, and still are, by the sort of resurgence of support and action led by the Black Lives Matter movement, in terms of drawing attention to the structural inequalities that have been around, but that have been exacerbated by the crisis. As has been said, I think this crisis brought great tragedies and continues to do so, but also a lot of opportunities in terms of people having the time to think and reflect about the kind of society we live in and what we need to do to redress some of these injustices. I guess the three calls to action that I could come up with would be: one, to support the growing consensus to lift no recourse to public funds for survivors of abuse, but also for migrants generally, to ensure that this welfare safety net that we may all rely on in some time in our lives is available for everybody who needs it, irrespective of their background or immigration status, and to push back against this hostile environment in terms of linking immigration and border enforcement to vital public services, which, as we know, disproportionately affects Black and minoritized people, as we have seen with the Windrush scandal. I'd like to see a commitment from local authorities, one, to fund specialist Black and minoritized services, given that we know that we're at heightened risk of violence, to provide support to all women and children, irrespective of immigration status, and also to create a firewall between these essential services and immigration enforcement, so that we can ensure all survivors who can seek help can do so safely without fearing repercussions for themselves, for their children, for their livelihoods. And to, I guess, flag our continuing campaign we have at SBS called Protection for All, where we are lobbying the government to sort of introduce legislative protections for migrant women. We're seeing the domestic abuse bill is expected to return to the House of Lords towards the end of the year, where we'll keep campaigning for change so that there are routes to safety and so that every survivor receives the support that she deserves. Thank you very much.
Oh, thank you so much, Janaya. That was very comprehensive, and I don't even know where to start. I think I'll start with Priti Patel. I think having a woman in Home Office should be making your job much easier, but for some reason, it looks like, you know, it's not about her gender, but I was actually expecting better changes, knowing what we know in our communities, but it looks like she's from a different planet altogether. and I'm hoping the domestic violence changes are worked on, and with empathy from someone of her stature. But I'll leave Priti Patel out of this, but for now I do hope that she responds to what you guys are doing, which is a lot of great initiatives. I mean, one of the things that you've spoken about is the initiative that we do need to have those Black ethnic minority hubs where we can go to. In Northampton, we don't know where to go. There are so many groups around, but we've been I can't even say the word. We have almost been broken down because of, whatever politics that we are into, but we do need a place, a one-stop shop for Black people to go to and say, what is going on? Where can I get this help? And when I say Black people, I'm not talking about Black Africans alone. It could be Asian, it could be anyone that is different, a minority group. We do need those hubs. They are so important. Just a safe place to go to and say, where can I get this? And they signpost you to the right direction. I think that initiative needs to be brought back to the table. In Northampton, actually, I know that they are working on looking at having a BAME initiative hub where we could go to get the different support that is required. It's a shame that it took 19 days for people to think, oh, what about the needs of women? And globally, it's been the same story. I do some conversations in Africa where girls ended up having the teenage pregnancies skyrocketed in most of the African countries. Again, it was like an afterthought, and yet this is 51% of the world population are women. What is going on that our needs are seen as secondary to yes, we do need economic drive, but there are other elements of who we are as a people that are just equally important. And I think, how crisis responses are brought into effect in the near future and in the next wave, I do hope that these lessons have been learned. Peer support is really critical in crisis times. And I know here in Northampton, we had a lot of mutual aid in different areas. And if you lived in a very vibrant, close-knit community, food was being distributed. There was, churches had pick-up points, and food was, I know there's a group of ladies who were taking food, African or specific foods, that you don't get from supermarkets, were being dropped. There were initiatives like that. So there was good responses, but like you said, at policy level and national level, if it took them 19 days to think, oh, what about the women? And someone had to shout about it. It's really, it shows that we in terms of leadership in crisis, there's something missing, and the voice of women has got to be transferred at national level. Marianne, what are your comments in terms of what Jayana has just said?
First of all, I have to apologize because I can't seem to see like the chat. But we don't have the chat where we can get the questions. So I think that is going to kind of derail us slightly.
Marianne, it's Rufia here, Councillor Rufia Ashraf. I was going to suggest, if those participants who have logged on to watch this today, if they can go to the right-hand side of their box and put the raised up hand, the blue hand, a blue hand will come up where it says raise hand, and we will know who's actually wanting to speak. I think that'll make it easier.
Yes, that's fine. Thank you so much, Rafia.
That's all right.
Yeah. Oh, so Marianne, what do you have to say about what Janaya just shared?
I think for me, the key thing, which has been something very personal to me, is the domestic abuse bill. And the fact that it has been pushed and not seen as relevant, you know, it's not, it was there before Parliament, even before this, I think before this Parliament, and it's been pushed and just been pushed. And I'm just hoping finally someone is going to say enough is enough, but it doesn't seem like it. And I think it's really important that we have that in writing in order to protect, especially the marginalized. You're not alone. I don't know how much impact that had really, because it sounded to me like the Stay Alert by Boris Johnson, Stay Alert, or like you can see what is coming, stay alert. So you have lockdown and now you have to stay alert, and then you have someone who is stuck and in home and they cannot leave their abuser. That is not, you can't stay alert. There's no staying alert when you're in the same house and you cannot go out because you have no access to funds, you have no access to refuge places, no emergency accommodation is available. Those are some of the key things that needs to be available, not only in London, but nationally. So those are some of the things, maybe an action that would come out of this meeting. So I'm happy there was some work that was done in a very local way, but again, we need policies from the government. It needs to come from a hierarchy such that that is duplicated and the effect is felt countrywide, not just within some pockets within, United Kingdom. So it's something that I'm really passionate about, so I don't want to go on about it, but the impact of COVID to someone already in this kind of situation. Imagine you have COVID and you're trapped in a home, in an abusive home. Where do you go? You can't go to hospital. You can't go to, where do you go? Where does this person go? Where does this woman go? Where do you go? It is a really, really sad situation to think of it in the 20th century, that people are living under those kind of conditions. So I think we will go to questions if we can, if anyone has some questions before we finally wrap up, which we should be doing so shortly.
Yes, thank you, Marianne. Hi, everyone. This is Councillor Ashraf. I'm one of the organisers of this event, and thank you for attending this afternoon. We've got a few minutes to take questions. So if you want to indicate by going to the raise hand indication, I'll take one question at a time and the panel can answer. First of all, we have Neelam.
Yes, good afternoon, everybody.
Hey, Neelam.
Yes, hi. Janaya, welcome to Northampton. I know there are lots of points and questions in my head, but I just wanted to acknowledge that Southall Black Sisters do amazing work. On many occasions, I have sent women to your organization and you have delivered, because locally we can't say that happens at any possible level, although things are changing, as Anastasia was alluding to, but it's taking forever. I think the biggest challenge women in my community, and I think in most community face, is the no recourse to public fund. Those are the women who have no money, no access to money, and they are told by organizations like Women's Aid to go and get a loan. When they have no assets, no finance, no job, who on earth is going to give them the loan, right? So you guys doing amazing job. Thank you so much for helping those women who really, really need it. I can't speak highly enough of you guys because you are the organization who are making the real difference to the lives of the women who are absolutely desperate and on their knees. Thank you very much. Thank you.
Thank you. That's really welcome. And I think you raised an important point, which is, the advice that women are given, the fact that at the point of crisis, as we know, it can take such a long time for women to feel safe enough to come to an organisation or to call a helpline or to reach out and seek support. And I think being battered away at such a vulnerable time is so concerning, especially when we think of the fact that it can put them at greater risk. If they're advised to go to obtain a loan, which puts them now in greater financial debt, or they are forced to go and stay with a friend or an acquaintance or a stranger and are at risk of further re-victimization. It's been said already about the fact that the economy the economy can't be the central concern of government, but even when we think about in terms of economic terms, we're only pushing the cost further down the line. You know, if someone seeks help and they don't receive it, the abuse is only going to escalate, and we're going to see, you know, more hospitalizations or greater mental health problems, or it's going to affect the children for a longer period of time, which will affect, as has been said, their behaviour within schools. The problem doesn't disappear, the women don't disappear just because you deny them the service. And all women are deserving of that support, irrespective of the immigration status or background or ethnicity. Thank you.
Thank you, Danaya. We next have Ritendo. Ritendo, over to you. You need to unmute.
Okay, I unmute,
Oh,
yes.
right.
Thank you so much. Thank you so much. Most of the things that I wanted to mention, actually, Nilam has mentioned them, issues of women who don't have recourse to public funds. What I've actually realized is what I was saying in the other meeting, really, to say the need for that awareness of, if you are on recourse no public funds, what does it really mean? Because most of the people out there in the community have got no idea what it is that they have access to, which makes somebody who lacks information already from the beginning more difficult for them to even accept a food parcel that we would have brought to them, because they feel like they are not allowed. And to make matters worse, there's funding. I don't know if there's anybody who attended a meeting in the morning about funding which has come out, and Hope Center is part of the funding as well. They are actually asking, if, say, suppose you get the funding, you need to actually capture information about the person that you're helping. You need to capture their names, their date of birth, where they live, and their reason for coming in, which already is a big barrier to the people that we are going to be helping. And the worst scenario is it's going to affect the woman more. I'm not saying men are not affected, they are affected, but the woman is going to be more affected because she is looking at feeding a family, which includes the men and the children. And that already, health and well-being is affected within that family. And like what Nilam said, really, where do they go to? Because they feel like they are actually alone and they've got nowhere to go to because of mostly lack of information. So COVID has actually made us as a group, has actually made us realize that there is actually more work than what we thought before COVID. And there's actually more issues that needs a lot of training for volunteers to go out there to be able to provide proper information and correct information to the community, maybe via, flyers, and also explaining to them or bringing them to the platform that they feel comfortable to air their problems. I'm so happy that sisters organizations representative is there. I've written down everything that you do. You are going to see us coming. It's so unfortunate that sometimes because people who run the charity organizations, especially the BAME ones, the BAME charity organizations that are already grassroots, because there is no paid member in the charity, it reduces the amount of time sometimes that we attend some of the meetings, and we get to lose out on some of the information which is vital to the organization, which we need to bring out down to the community. So maybe my thing is to say, if there are organizations which are out there, please do reach out for us as well, so that we get to know what you offer. And lastly, all I want to just say is for everybody to actually kind of like share information on everything that they get to know about anything that has got to do with the BME communities, so that we can actually expand our work out there. And it's not just the BME community, really. It's not just the Black ethnic minorities. It's all of them. Like, this platform has been created, only that I'm more on the Black community, which sometimes is at a disadvantage, because Africa, like us, the black
Tendo, sorry to interrupt. Sorry to interrupt. We just wanted to alert you. We've got 2 more speakers before we sum up. If you can ask your question quickly.
I'm almost at the end. The last point, really, to mention to everybody, to say it's a continent. It's not a country. For just people to bear that in mind.
Right. Thank you.
Thank you so much for that. And like you said, yes, there are so many vulnerabilities that we can address. And we'll go to you now. Is it Maggie that is?
It's Claire before that.
Yes.
Sorry, Anderson, it was Claire who raised her hand first.
Okay, go on.
I'll try and keep it there. It is a question.
Yeah. Thank you. I'm going to keep it very short. I like to address my question to Emma, the doctor. You mentioned that about the vitamin D, that we need to take at least like 400 units or something like that. And my query is about, can we have too much of it? Because if someone has been taking since April, and I know somebody who has been doing that, are there any precautions we should take? The other question still to you is just to clarify for us. We've been told, or sometimes the government mentions that children are, I don't know whether they mean they are less likely to spread the virus or less likely to be impacted. And that means there is something that's not very clear, and I don't understand what they mean with that, because my understanding is if you have a virus and you come into contact with somebody else, you will spread it. Whether the impact is the same, I do not know, but I need clarification on that. My last bit, which is like a concern I would like to raise to the BME group, is that we need to be aware and to be actually proactive when it comes to some existing counter narratives about our community. Now, I'll give an example to clarify. When Leicestershire was under lockdown, there was some talk out there in the media that maybe the community is the way they interact, it's about them, and people can blame the victim. And you need to be aware that these are things which are sometimes passed on, saying that Black people, they are responsible for this or the other. Finally, another counter narrative. We've had, given the long history of Black boys' exclusion and underachievement from school, we've had the successive conservative governments highlighting the exclusion of Black working class boys. I'm not sure that white working class boys are disproportionately excluded, but this is brought there to highlight or to distract attention from the very needy. So it's just aware that we as a community, we need to be proactive and kind of identify these narratives that come in to reduce the emphasis on where the real problems are. Thank you.
Thank you, Claire. Emma.
Thank you. Just to say, the first question, vitamin D. It's very difficult to give yourself too much vitamin D. You have to take the equivalent of about 10,000 units a day for a very long time to give yourself too much. The NICE guidelines, which is the National Institute of Clinical Excellence, what we doctors are guided by, basically says that if, for example, I check your vitamin D levels and I find them low, and I start you on a vitamin D tablet at a standard daily recommended dose, I do not need to check you again ever again, and you can stay on it for the rest of your life, and you will not get too much vitamin D, because your body metabolizes what it needs every day, and that's it. So you can't. It's very difficult to give yourself too much vitamin D. It's possible, but very difficult. The other question was about the government's stance about children. I think what the government basically is saying is that when children get it, they don't get severe symptoms. So most children will be asymptomatic carriers. They'll have the virus, they'll be either asymptomatic or have a very mild minor illness. And therefore they are fine. But they do spread it around. So children are the ones who take it to their grandparents and will take it to the more vulnerable people in the family. And that's why you have the government saying that if you have risk factors and you're more vulnerable, you should shield even from your grandchildren. So grandparents and people who have got kind of physical health conditions that put them at increased risk are told to shield and not get in contact with people who are out there for that reason. So yes, they do spread it as much as anybody else. They themselves are not affected. They have mild or asymptomatic illness from COVID. I hope that's answered your questions.
That's great, Emma. Thank you so much. And Maggie, you're our last participant if you want to ask your questions.
Yeah, thank you very much. First of all, I'd like to say how wonderful it is to be able to join in this today. I've learned so much. I met SBS when they came, and when I did my Women's Studies MA in Northampton years ago. So hi, I met some of you then. Wonderful work. So everything has been that I've said, I don't disagree with. There's a thing that's stuck in my mind from early on. There was a lot of attention, I suppose, that it's been brought up more latterly on young people and education. All that needs doing. I think there is a big issue about mental illness and older people who aren't being visited, and any of us can help and call and do that. So I will offer, I'm the chair of the CLP, I will nag people to offer to do that. And I'm just very aware of it. It is, we can help with your community and any community. It's a real big issue. So older people are more at risk. They are not always visited. We may not know them. I really want to know, have you got names and numbers that you'd like to pass on? Any of us can help with that. Okay, thank you.
Thank you, Maggie.
Can we? I should have said that was the question.
That's all right. Thank you so much. Can I just sum up this afternoon? I think I could write an essay on what we've just spoken, and we could talk for more than 1.5 hours, definitely. First of all, I want to thank everyone for participating. We have heard from some powerful women today. And first of all, I would like to thank the Borough Council for hosting the event. I'd like to personally thank the chair, the panel speakers, the women who's actually logged in and taken their time out this afternoon to take part, and also the organisations that couple of our councillors and other support workers have done some really fantastic work to get this event together. This event is actually in its 3rd year, and I'm so thankful for all your participation. It makes a difference when you join and you ask those questions. So from what I have heard today, I can see a couple of priorities, but there could be more. But let's start somewhere. I think the BAME community are not really represented very well in a broad way. However, listening to you today, there are some issues that you've mentioned that are not new issues. They're still there, and I think we need to still fight for them. So the first priority I am looking at, and it's been mentioned at the beginning of the conversation, is about the health and well-being. It's the exercise, the diet, using of technology, using the right technology and knowing where to go for that technology. our community groups come from 3rd, 4th, 5th generation. They may not already know the system and the processes to help their children to learn from home. I think we need to help them break that barrier down and get education to go a little bit further to help those families who are vulnerable and in that situation without labeling them. I think it's also important, second point is, it is about you having a local, having support at a local agenda to have a voice. We can talk all day, but if we can't get you ladies to talk at the right agenda in the right place, we don't get heard. We don't get listened to. So your voice is really powerful on what you've said today, but we need to take it somewhere. And I think coming away from this, it will happen. And finally, I wanted to say is we need to improve how women are involved in major decision-making in the future. Without you, we don't exist. And if it wasn't from your experiences and the lack of experiences, we wouldn't be having these conversations today. So I think there's a couple of really good points and more points that we can actually take away from today. And we need to start working on them together collectively, not separately in our own groups. But now that we have this platform, is a fantastic platform. Before I disappear, can I just bring Danielle in? She's an educator, and I know she has a wealth of experience. I just want her to say a couple of words around the education aspect, because I think she'll have some really good pointers to add to this. Danielle.
To be honest, Rufia, what I've heard today is from people who are expert in their own fields, including you and the co-chairs, and I am very moved by that, I have to say. And I've written a huge list of things arising out of what has been said that I, as a politician, you, Rufia, as a politician, we can start thinking about and we can start taking forward. The whole issue around education is a passion of mine. With Marcia, who's here with us, we used to run Raising Black Achievement programs, which were highly successful, but the funding for that was discontinued. Marcia used to, for years and years and years, support a Saturday school for young Black people. That has been made very fragile if it still continues at all. We need to think about self-help within the communities, and that's absolutely the right way to go. But there's also a political imperative, and it is my duty and it's Rufia's duty to create those political platforms where voices are heard and demands are made and decisions, as Rufia said, are made for people in the right kind of way. So thank you all very, very much indeed. It's really important for us as politicians to hear the voice of the people. It is really, really important. We can't speak with any integrity or any authenticity unless we hear those voices. Thank you.
That's great. Thank you so much to everyone. That's the end of our event. I look forward to having conversations with you over the year. If not, we'll meet again in a year's time. Thank you, everyone.